Good morning. Today we're going to be talking about why you should take precaution and why you should wear a mask. So today, some things we're going to talk about today are COVID-19 numbers, mask wearing, why you should care about the health of those around you and yourself, mask persuasion, safety and additional precautions, statistics, factors and stages, and my resources. So the first thing I want to talk to you, according to Raina et al., is this little table here. On the y-axis, you will see that there's a number of cases going up to 140,000. On the x-axis, you see many different colors, each representing a different country, where you see the China is the outlier, where it kind of levels out here. But for the most of the countries over here, you see an exponential growth. So one of the main reasons I want everyone to take precaution is that according to Yifan Zoo, there's 180,000 cases as of March 17th. That's a little late, but we still have a lot of rising numbers according to today. So that is a big reason why you should care about the pandemic, because it's affecting a large amount of the population. So next, I want to talk about why improve the health of those around you. Well, hospitals are one of the main facilities that actually care about your health. And according to Health Facilities Management, hospitals found relocation sites for COVID testing. Why is this a big deal? Well, for high-risk patients that are living in hospitals or going through surgeries or stuff like that, they are actually high risk, and so relocating COVID testing sites in more accessible areas and having a different staff that monitors the COVID testing actually allows for hospital patients to actually be safer, and for the hospital staff actually to be safer and be able to work more. So that is a very, very big reason why you should care about this pandemic. Like I said, 180,000 cases. That's a very big number. Masks are made available pretty much at any local Walmart or almost any store now have disposable masks up at the front of the store. So that masks are made available for everyone, so there's a reason to care there. And Tina says repurposed remedies, which we'll go over in another slide. So according to Need More Face Masks, masks are made available at cheapest as $2, but like I said, at many stores they're made available if they're disposable. But the solution here is to wear a mask and make sure that the nose and chin are covered. Shown here in this diagram, the do's and don'ts. So like I said, the nose and the chin must be covered. So yeah. Next, I'm going to show you a video by Uber, who is a very big name brand that has made an advertisement about masks. So, as the video said, no mask, no ride. Many businesses have actually refused service to people that do not have face masks. So, Heather Onorati said there's very many ways to create innovative face masks using repurposed cloth. So, there is really no excuse to not having a face mask at this point. We're this deep into the pandemic. So, yeah. So next I want to talk about Tina Say's remedies for the pandemic. So first and foremost, wear a mask, but second, staying home is a very good way to reduce the number of people that you come into contact with and reducing the spread of COVID. Next, I would say social distancing, which is 6 feet, as we all know, and then donating plasma, which you have to be 18 years or older, 110 pounds and up. And you have to be screened to make sure that you're not testing positive for the virus, obviously, but donating plasma is a very big remedy that can help save many lives at this point. And disinfecting your surfaces often and washing your hands often are another couple of ways that you can reduce the amount of COVID case rising numbers, sorry. And as Gary Eno says, also common sense. That is the biggest thing here. Just not getting close to people, covering your cough, stuff like that. So common sense is the biggest thing here. Next, I want to talk about factors and stages. We're going to talk about the infection window of transmission. That is the time in which that you can infect someone. This overlaps with the stage of showing symptoms. The frequency rate is how quickly that it is contracted. This is higher than most diseases, so that is something to be aware of. Hospitalization rate, that is how quickly people are going into the hospital, as I showed in the first slide in the statistics. And the case confirmation stage and testing. So that kind of obviously is when you go get tested and find that you've contracted the disease or not. Going to get tested for antibodies is another thing that you can do just to see if you are able to donate plasma. So the counter argument Peter Glick makes is emasculation. So basically what he says is wearing a mask emasculates him and he isn't able to show face and be his true self, along with sound and speaking being prohibited, face sweating and fogging glasses, CO2 intake, asthma, and other breathing disabilities have heightened, obviously. So those are the kind of the counter arguments there. Besides the CO2 intake and the asthma, being emasculated is not worth risking your life, so wearing a mask is probably best. But if you are concerned about CO2 intakes, there are now masks that address those situations, and if you have asthma and stuff like that, you could use a face shield. So, summary, why you should care: there are rising numbers in the infection rate. Precautions to take: mask wearing, social distancing, staying home, and donating plasma. And data you should consider: over 180,000 cases, and resources that provide assistance: CDC, AHE, and ASHE. These are my works cited, and thank you for listening to my speech.